Dr. Merhi, welcome to the Sakara Life podcast. We're
Thank you so much. Thank you so much. I'm very, very excited. I've been waiting for this podcast and very excited to be with you.
Yeah,
thank you for the Sakara treat you gave me. I love them.
Yes, always here to support people on their health journeys, like you're doing with a lot of women out there. And I'm excited for this conversation today. I mean, you're an expert in fertility and you're doing a lot of really cutting edge therapies that I'm excited to dig into. But even if you're a listener right now listening to this and you're not interested in having kids or you're past those days, they're behind you, this conversation is still for you. The work that Dr. Merhi is doing is incredible in the longevity space, regenerative health space. So let's dive in. Dr. Merhi, what is your mission here on Earth?
Well, first of all, thank you so much for having me. I can tell you my mission, which I feel like it just started, even though people think we've done a lot, but really there's a lot of work to do for women's health, for fertility. And our mission at RFC is to help any woman at any age, regardless of her weight, have babies using her own eggs. Because I really think there's a lot of, I know there's a lot of disparity for infertility in the fertility world, against overweight women and against older women. And they're not treated fairly, in my opinion. And even though they have the chances to have pregnancies and babies using their own eggs, we need to be better doing that. But also we need to help women, even after menopause, have babies using their own eggs. That's the reality.
Wow. And I know that you are a reproductive immunologist. Can you talk about what that is? Because I think it's really interesting because I don't think people think of their immune system when it comes to things like, their ovaries, their reproductive health. But it really relates to a lot that we talk about here and, inflammation, et cetera, that we speak to often at Sakara.
Look, Danielle, everything in our body, everything around us, everything in this world is inflammation and immunity, everything, you name it. Eat crappy food now, you're going to have more inflammation in your body. Eat healthy food now, in a few weeks, it's going to be lower inflammation. So same thing, pregnancy is an inflammatory process. You need some immunity or some inflammation to have that embryo baby grow inside the body because it's a foreign body. Remember, the baby is half sperm, half egg, and the part coming from the sperm is foreign to woman's body. So technically, the body can reject it. It's like kidney transplant. You need to find the perfect match. But when you have a partner, you don't test them before to see if they're perfect match before you sleep with them and have babies, right? So there is a lot of mismatch between couple. So all that, the body starts to attack. So the pregnancy is an interface between some inflammation that's important for implantation versus too much inflammation and too much immunity, then you're attacking your own embryo. So if there is an imbalance there, that causes recurrent implantation failure and recurrent miscarriages. And by the way, I'm not trying to brag, but I should. Jessica Harun, our nurse, and I we received an award from the American Society for Reproductive Medicine, ASRM, next month. Oh, yes, October 2025 in San Antonio for the work we've done for reproductive immunology.
And is that like helping sort of systemic inflammation, or are you talking about like localized inflammation, or both?
It is treating targeted inflammation, Danielle. Listen, if I have inflammation in certain lymphocytes in my body or natural killer cells, there is tests. We do comprehensive tests. We use tests called Pregmune. The comprehensive test tells you about if there's mismatch between the couple, what inflammation are abnormal in the body, dietary issues, vitamin D, thyroid issues, so clotting disorders. And then based on that test, we will target the inflammation. For instance, if someone has high natural killer cells, those cells are, if they're too much, you need them a little bit. If they're too much, they can cause recurrent miscarriages and implantation failures. So what we treat them with intralipids, right? For example, infusion once a week, right? So what I'm trying to say is there is multiple types of inflammation that could target pregnancy, and we need testing to give you individualized targeting to treat that problem in order to help the pregnancy. That's only needed in the first trimester. After that, the body takes over, and then your patients on their own second and third trimester.
And how did you get into this specialization?
Thank you. Yeah, I was always interested in immunology and inflammation, and I've been studying this since I was a resident, almost 2 decades. Because again, everything is inflammation. My interest has been diet, obesity, how it affect ovarian function. Right, this is my expertise, and we studied a lot of inflammation on how it affects ovarian function. But then, when Braverman, God bless his soul, Braverman Reproductive Immunology (BRI), they shut down in August of 2024, and then Dr. Vidali and Dr. Thornton, who I love them. They're smart people. They said, "Would you be willing, knowing that you have expertise, would you be willing to take over the BRI program?" And now all their patients come to us, which is, I'd love to help people, but it's a lot of people with inflammation and immune, and people coming back for second and third babies. So it is pretty intense. Jessica Haroon, our nurse, is running it, and with me, and she's doing an amazing job. Like I said, she won award at the ASRM, American Society for Reproductive Medicine annual meeting.
And I actually know somebody who did that program for herself in order to have a baby, because she had autoimmune conditions. I think going into it, she didn't even know she had autoimmune issues, and discovered it through this process of discovering why it was challenging for her to have a baby, and was able to work with our mutual friend, Amy Raup, who that was one of the ways that we got connected.
That's right.
Dr. Merhi.
Love Amy Raup.
She's incredible, and another incredible fertility expert. And worked with her on an anti-inflammatory diet and autoimmune protocol to help support the process. So I think it's something that is really, under what's the word I'm looking for, but it's just not known enough in this space. And often so many people are discouraged and disappointed when they go to these quote unquote fertility clinics, and then they find out that they're not focusing on actually supporting fertility. They're just an IVF machine. And it sounds like, in your practice, you're really looking to get to some deeper root causes and supporting
true
the
health.
body. Yeah, really looking at true health and helping the body to get to that place where it can be fertile and support a baby, rather than just going straight into IVF, which may or may not work for them.
Look, like you said, Whitney, immune issues are very, very common. You have Hashimoto's, celiac disease, arthritis, lupus, you name it. Like I said to Danielle earlier, everything is inflammation. Endometriosis, over 50%, and this is according to the ASRM, over 50% of women trying to get pregnant have endometriosis. I assume everybody it's an inflammatory thing. So diet, stimulate, everything affects that. You cannot ignore those things. Now, I always tell patients, and call me crazy, I am borderline, 40% of my patients, I tell them, you don't need IVF. And it's true. You see my social on my Instagram. A lot of my patients, I do treatment, hysteroscopy, fixed the uterus, immune, bam, baby, after many years of trying to get pregnant. It's not IVF is the answer. It's really not. And let me tell you, I blame the doctors. I'm sorry. I know a lot of people are going to hate me right now. It's okay. I blame the doctors for this, because we are trained in a way, this is it, this is it, this is it. And we're not stopping to think outside the box or say, okay, maybe I should go left if everyone's going right. But not only this, there is a lot of politics for fertility, and everybody is hands tied up by their bosses and their bosses' bosses to keep them happy and to increase the revenue and to have more IVF cycles. and pregnancy rates and pregnancy success. So they care about their pregnancy rates because they think, oh, yeah, my pregnancy rates are highest. I'm better. I have the best lab. It's bullshit. I can choose my patients. I can get everybody pregnant. If I choose patients in my 20s, I can get them pregnant. I might say my pregnancy rate is 100. But in addition to this, what drives me crazy about our field is that they tell, for instance, patients, oh, diet doesn't affect fertility. I'm like, so I went on PubMed. Listen to this. I went on PubMed a few days ago. Patient was telling me that she was told this by doctor. I said, diet and fertility, to see how many medical scientific articles. 6,580, let me repeat that, 6,500, 100 of them is probably from our studies on vitamin D and diet. And they're saying how it affects fertility. But yes, doctors still saying, I just don't get it. I really don't. It's really sad. I think most of doctors are becoming robots. Again, I love my colleagues. I really do. But it's what bothers me about the field is they discourage women from looking at other options. Don't discourage if you're not aware or reading. I'm going to give you an example. I'm probably going to talk about it. PRP, ovarian rejuvenation. A lot of doctors
I was
until
going to say,
now.
let's go there, because I think like your expertise is so interesting, because that's why I wanted to start off with this idea of the immune system and reproductive health and vitality, is because it requires that you look systemically at the body, not just through this microscope at like the ovaries alone. Or the hormones alone. So yeah, what are some of the tools that you use if you say you might not put a patient on IVF? What are the other options? Because I think what you're saying is that most women are left to feel so discouraged, and also like they have to hand over like their fertility health to someone instead of feeling like they're in any kind of control over the health of their reproductive health.
Look, Danielle, a great question. And all I can tell you is this. Women is not an egg and a uterus. It's not. Everything is related, from the brain to the psychology to the positivity, all the way down. And I don't care what anyone else said. Let me tell you, we've helped patients who walked into our office and asked my staff. So believe me, depressed because they've been through hell, crying. Just by talking to them after the first consultation and relieving their brain and positivity, they got home and got pregnant. I swear.
Yeah,
and
totally.
I tell these stories always to Roseanne Austin, who I love. She works on the brain and positivity and mindset. It's very important to start up there. Second, what you eat is what you are. I tell people you need to listen. There's microbiome and all the bacteria in the GI system. Plenty of studies now saying that it affects fertility, Alzheimer. What does that tell you? It's all related to each other. So before I jump to IVF, one, you need to know what the story of the patient is. What's happening? If someone has ovulation every month, regular period, sperm is good, tube is open, never seen a positive pregnancy test, well, her uterus is not receptive. There's implantation problem. Don't blame it on her ovarian reserve and age and egg quality. She's not even seeing a positive pregnancy test. So there is something in the uterus. You following me? So every person has a different story, right? And I really think the story to me is the most important. Then I like to work on the body for a month or two to optimize treatment before I say, okay, let's do X or Y or Z.
And so let's talk about the ovarian PRP. So I think most women listening or most people listening might be familiar with PRP in terms of facials, where they take platelets from your own blood, they spin it, and they then kind of roll on your own white blood cells.
That's why my skin is cute.
Yeah, your skin looks great. But so this is injecting the same sort of immuno kind of molecules, compounds into your ovaries instead of on your skin. So can you talk about that process, what it does, and what kind of patient that's right for?
Okay, so let's start by saying that you need to give credit for the Greek people because they started PRP, ovarian rejuvenation, maybe 10 years ago on postmenopausal women, and they reported and published a lot of those women getting pregnant naturally after sex.
Wow.
After menopause. Let me repeat that. Because women in menopause, they still have 1,000 eggs left inside their ovaries, but they're dormant. They just live in an ovary, these eggs. It's like, I'm going to give an example that I'm going to use till the end of the talk. I think it would be easier, but sorry if I'm not trying to be, but the ovary is like a lake, and the eggs are like fish. You're born with this lake and certain number of fish, right? Every month, a fish jumps and you catch it, see if you're pregnant. This is ovulation. Now, as women get older, there's less and less fish because they use a lot of them. But those fish now, they live in an environment. The water in the lake is now muddy and dirty, inflammation, everything. So now the fish can't move. And this is when you stop having any fish jumping. So it doesn't mean a postmenopausal woman that she's not having an ovulation and period doesn't have eggs. She still have 1,000. And we know this from 70 years ago. It's not something new. The question is how to wake them up. And this is what the Greek people started with, the concept of ovarian rejuvenation. Then we brought it to the US and we started doing it. Now, what is it? Like you said, Danielle, patients come, we take blood from their arm, few tubes, they wait in the lobby, we spin, we take the PRP, the platelet-rich plasma, which have a lot of growth factors. It's like a human growth hormone. So many factors that the ovary or the lake we're talking about it cleans up the smog, if you want to call it, or clean up the water and environment for those fish in order for them to be happier and started to kind of move again, right? So that's mechanism, but there's a lot of cellular mechanisms that works on improving the quality/quantity of eggs, or both.
And what is kind of the success rate that you've seen with that? Because, some people will say it works and some people say that doesn't really work. It's not worthwhile. What are your thoughts?
Well, if you say about worthwhile, IVF is not worthwhile then either. Why? Because it doesn't work. 50. If you look at the statistics in the country, 50% of IVF patients get pregnant, 50% not. The question is it worthwhile or not? It's very hard, Whitney, to give a percentage, not because I'm hiding it, because we do a PRP, ovarian rejuvenation, for heterogeneous people of groups, and you cannot compare apples to oranges. We do it for women in their 20s with premature ovarian insufficiency or early menopause, to women in their 30s, to women in their 40s, to women in their 50s. That's one. Two, we do it for women in menopause. We do it for women who have a lot of eggs, but poor egg quality. You can't combine both. I can't compare a woman in their 20s with menopause to someone in their 50s and menopause. Why? Because now the quality of age is important for the quality of eggs. So it varies from patient to patient. All I can tell you is some people have genetic disorders. They don't respond to anything, PRP or adipose, whatever you want to call it. So it's really hard to put apples and oranges. All I can tell you is this. With our experience, if I have to give you a number, 60% of women doing PRP will have some type of positive response. And I'm talking about positive response. I'm not saying about pregnancy. Positive response is inducing ovulation or having good quality egg. And let me tell you why it doesn't translate to pregnancy. Pregnancy, you have the sperm. Everybody blames the egg, but 50% of the embryo is sperm. And let me tell you, a lot of men, and now the American Society for Reproductive Medicine included sperm DNA fragmentation in women who have miscarriages as a test, because the quality of the DNA of the sperm, which, by the way, people used to make fun of us when we used to test the men, it plays a role. It's huge. 50% is the baby. Okay, now let's say I give PRP ovarian rejuvenation to patient X, her husband Y, great sperm, but now patient has implantation problems. She's not going to get pregnant. It doesn't mean the PRP didn't work or the ovarian rejuvenation worked. 30% to 35% of women have implantation issues. Get any good embryo and put it in a woman, 30% or 35%, they won't stick. So what I'm trying to say is, if I have to guess a number, I would say 60% will have some type of positive response from the PRP.
Right. It's very individual, is what you're saying.
Exactly.
Is there any sort of response that you can feel? Like, is this something women do, even if maybe they're not necessarily trying to get pregnant, but maybe just like maintain some kind of like youthful feeling? And,
Yeah. Great question, Danielle. We do it a lot for longevity and for people who don't want to take hormone replacement therapy. I have patients, they do PRP at last 3 months. Every 3 months they do it because, one, they feel better. And let me tell you, when you do PRP, you're not just waking up eggs. You're making the ovary produce estrogen, testosterone, DHEA, DHE. All those things are important for the mental health, sleeping, libido, sex drive, even vaginal dryness. It helps. And we've published this. It helps up to 13 weeks. So it does help. The question is, unfortunately, it doesn't help forever. There's nothing permanent. But yes, to answer your question, the PRP and the adipose PRP, which I do now, mini liposuction from the stem cells as well, that help a lot with the longevity of women and other things that not just reproduction.
Let's talk about the stem cell part too. Very curious about. So we just covered PRP, which is a treatment that you can do on the ovaries. I think you said you could also do it on the uterus if you have endometriosis or different issues there. And then now you're starting to add also stem cells into the mix when it comes to rejuvenation. So how does that work?
Sure. So PRP, let's finish the PRP for the uterus because I didn't really talk about it. And like I said, 35% of women could have implantation issues. But remember this. Everybody focus on the woman's age and egg. Everybody, which drives me insane. There is something called endometrial insufficiency. You can have a perfect lining, but it's not sticky. So you need to focus on that too. And this is my expertise, part of my expertise. And that's why I tell people you don't need IVF because, and I brag about the patients who get pregnant after I inject PRP in their lining. PRP activates stem cells. We have stem cells in the ovaries. By the way, there is plenty of studies show activate those stem cells to become new, younger eggs. We didn't talk about it, but we can talk about it some other time. But now if I'm injecting PRP in the lining of the uterus, and a lot of people have Asherman syndrome, scarring, the determination of pregnancy in the past by DNC, they had C-section, myomectomy, the lining gets tired and it's not sticky, they have failed implantation or recurrent miscarriages. Take PRP, go with the camera or the hysteroscopy and inject. The lining have stem cells. Those stem cells, if I inject PRP, they can get activated to become a new fresh lining, better than the lining they have. By the way, and you should Google it, the period comes from a woman have stem cells. There's now something called menses-derived stem cells.
I've heard about women putting it on their face.
Exactly.
Is that how you have such great skin?
Yes. You can take stem cells from the period and those stem cells, extract them, put them anywhere. But look, guys, Danielle and Whitney, stem cells are unique because they can become any type of cells based on where you put them. Summary. If I take stem cells from my fat, put them in my kidney, they have the potential to become new kidney cells, but they're better than the cells I was born with. Put them in the liver cells. Put them in the ovarian cells, or potentially eggs. Put them in the brain. They're treating it for Parkinson's disease now. Now, there is plenty of report on men and women who are paraplegic on wheelchair. They're walking. Because if you have a spine that's cut because of a car accident, you put stem cell in the middle, because it touches the nerves, it becomes like them and differentiate into new neurons, and it's making the spine whole again, and they're walking. So the Japanese people, or Chinese, I can't remember which one, they're treating now type 1 diabetes with stem cells. Type 1 diabetes. So
yeah, that was
you're going to see
China.
China, exactly.
Yeah.
So you're going to see a lot of people living longer. That's part of longevity. You know, it's interesting whether you're religious or not. The body, it's amazing how the body has its own treatment and stem cells, and you can cure yourself with your own body.
And so, a couple questions. Who would you put on PRP versus stem cells, and what is the procedure difference? Like, is it the same? Do you have to go under? Is it considered a surgery?
Well, it's not considered surgery. It's a very, very minor procedure. The PRP, you know the PRP, you take it out, inject it in the ovary. You can put it under IV sedation or local anesthesia. You can give local anesthesia on the vaginal wall, like going to a dentist, sorry for comparison, inject it. That's the PRP. Now, the adipose PRP, we take patient to procedure room. Patients, I've done it under local anesthesia. You know, they do liposuction when patients are awake in a lot of places. But this is even much smaller needle. A tiny hole in the skin after I give local anesthesia, remove a little bit of fat. I use an FDA-approved kit. I remove the fat to get as many stem cells as possible, mix them with the PRP and inject them. Usually,
Is
most
it all
patients...
in the same day?
Yes, all in one visit. All in one visit. Yeah, usually patients, they like to have some, we give them anesthesia, propofol, it's good sleep, so they won't feel anything. But I've done it on patients who are totally awake, many. So a dozen, I would say. So yeah, it's not major, it's very minor, same day procedure, everything is done from beginning to end, 20 minutes, and that's it. 2 hours. Yeah.
And you just have to, dilate the cervix?
No, you don't go through the cervix at all. This is the vagina. The ovaries are next to it. You poke the vaginal wall, inject them in the ovaries.
Oh, interesting.
But you don't go through the cervix, not through the uterus, not through the tubes. You don't touch them. Now, you ask me which one is better. I don't know the answer. There is no study comparing PRP alone to adipose PRP yet. Now, most patients start with the PRP. It's good for 3 months. If it works, congrats, we celebrate. If not, we move to the adipose PRP. Now, the PRP alone lasts 3 months. The adipose PRP lasts 6 months. Why? Because you're putting two things. Now, some people say, I don't want to do PRP. I want to jump to adipose PRP. It's totally fine. But I can't tell you or any patient, okay, this is better than this, because I don't have a study comparing A to B,
And what about when it comes to longevity? Are you seeing more lasting outcomes with the stem cells? If a woman is wanting to avoid HRT and go down this path?
Yes. Actually, with the adipose PRP, and this great question, Whitney, we're seeing, as I mentioned earlier, it's last 6 months on average. I'm having some people ovulating or having eggs popping, and they were in early menopause, up to 8 months. I actually have one patient after 1 year, she gave up because she broke up with her partner, walked into my office one day. She was in menopause, walked out. She said, I want to tell Dr. Merhi, that I'm having now period and I have 10 follicles on my ovary. I was at my general OBGYN. That's after 1 year. And we just wanted to tell him because I know he likes research and he's tracking the data. I was like, holy shit. It's crazy. So, but I don't know, Whitney and Danielle. All I can tell you is we're human. There's a lot of factors that play a role. But I can tell you for longevity, the adipose stem cell is more powerful than the regular PRP.
Yeah. And we have another mutual friend who came to see for fertility, another one who helped us make the introduction here. And she told me after she did her procedure that she felt her body just turn on again. She felt her hormones turn on. She felt her energy come back, her libido come back. She noticed some changes in her skin, had a little breakout. She was like, I'm like a teenager again. And so, I think it was nice to hear firsthand from somebody who has done this procedure that she could feel something happening in her body right away. So it's definitely interesting. And I've also heard stories about women getting stem cells in general who have been, post-menopausal, getting their period back. So it makes me start to think about what that means for the rest of our body. Because as our ovaries start to wind down and shut off, that affects our heart, it affects our brain, it affects so much of our bodies and our health. So are you seeing those kind of results as well? And how does it affect hormones overall?
This is all I can tell you. And as I mentioned earlier, I like the example of the lake and the fish. The adipose PRP cleans up the whole lake in many ways and make those fish much happier. Let me tell you how it works. One, there's multiple mechanisms. There's 6 of them of how adipose stem cell improve ovarian function. Okay, I'm going to try to remember them. 1, immunomodulation. It lowers ovarian tissue inflammation. That's very important. 2, anti-fibrosis. Fibrosis is stiffness. As we get older, our tissue is stiffer, right? So the stiffness in the ovaries, guys, it pushes on those eggs mechanically, and the eggs can't develop follicles and ovulate. Now, the stem cells are releasing that stiffness to make the ovary softer again, okay? 3, anti-apoptosis. Apoptosis is cell death. This slows the death. 4, it improves folliculogenesis and granulosa cell differentiation. It helps the dormant eggs. In regular language, the dormant eggs, it helps them grow to become follicles and ovulate. Okay, there's 2 other mechanisms. I'm happy to antioxidation. This is one effect. Oh, and finally, angiogenesis. Angiogenesis is the formation of new blood vessels. And as we get older, the small blood vessels get shut down because the ovary is shrinking. That's why it shrinks, less oxygen. So the stem cells induce the formation of new small blood vessels, increasing oxygenation to the eggs that are there. So this is how it works. And that's why the longevity part of adipose stem cell PRP is significant. And everything I'm telling you is supported by science and scientific studies that I'm happy to share.
And is it, you're doing adipose stem cells. I know that there are different types of stem cells. They can come from their embryonic stem cells. I know there's bone marrow stem cells that you can get from donors. And then there's your own stem cells that you're getting from your fat. Do you see any difference between them and your success rates? And then also, what are the risks involved with those other different types of stem cells?
Great question. So there's plenty of studies on stem cells on humans and reproductive system. The stem cells could be coming, the most common ones are the adipose, which is the fat. 2 is the bone marrow. 3, umbilical cord coming from newborn babies. 4, placental stem cells. 5, amniotic fluid stem cells. Embryonic stem cells, and induced pluripotent stem cells. And finally, menstrual blood derived stem cells. So there's more than 8 that I can remember now. Now, the ones embryonic stem cells and iPSC or pluripotent stem cells, I don't touch because those has the potential to become cancer. I don't. Now, the ones that I do, and I do them in the Bahamas, are umbilical cord stem cells and exosomes. Let me tell you what the difference is. There are companies in the United States that they collect cord blood from newborn babies by C-section here. They collect the cord blood, and by the way, they have FDA approval and everything to do that. They collect the cord blood, remove the stem cells, and those stem cells, they sell them to different doctors, and we put them in different tissue. Now, I like those. We have them. We ship them to the Bahamas, and then we inject them in the ovaries. Some people, for religious, ethical reasons, whatever, say, I don't want the DNA. I don't want the umbilical cord stem cell because it has some DNA from the newborn baby. This is what the solution for this is. They're exosomes. Exosomes is bubbles that are released by those stem cells. They are super sexy now in the fertility and non-fertility world. Everyone's using them.
And in skincare too.
Exactly. Mm-hmm. You sure you were not dermatologist back in the life? You know a lot about skin. So the exosomes are amazing because they have everything concentrated in them that you need in a stem cell. And you can purchase it, buy it, and put it inside it. That's what I do in the Bahamas. I love exosomes. They last up to 6 months, and they're really huge. So Those what we do.
And those don't contain DNA from the donor? No.
Nope.
Interesting.
There is no DNA nucleus. There is no, they have nucleic acid, but not the DNA. No, it's not. It's totally safe. It is halal, kosher, whatever you want to call it. There's no issue with that.
If you're taking stem cells from your own body, I talked to a stem cell doctor about this once at an event I was at, and he said, well, your stem cells are getting old. Like, don't call me old, but okay. He was like, well, they're a whole lot older than a baby. Or even, these donors that do the bone marrow, it's usually like taken out of the hip, and the donors are in their early 20s typically. And so he was saying that those work much better because they're younger stem cells than if they're taken from yourself. Do you agree?
I partially agree. The answer is yes. And that's why we're doing the umbilical cord stem cell exosome. They come from newborn babies. So there are theories that also stem cells do age, and the ones coming from newborn baby are better. However, I don't have any study comparing this in humans. So I can't tell you if it's real or not. Honestly, I tell people everything is trial and error. What works for you might not work for somebody else. And until you try it, I don't know if it's going to work for you or not, or which one is better. I have people who did the umbilical cord stem, even though they're younger, but they did better on their own adipose stem cell and they're older. So I don't know. I think every stem cell has a value. The question is, which one is best for that person's ovaries and how much you put in it? It plays a huge role. And how many times you need to do it? The question is, we don't know. Do I need to do it once every 3 months, every 6 months? I don't know. So this is what we're trying to tease out and figure out in the Bahamas.
And why the Bahamas versus the US? Is one considered legal here versus the Bahamas, or why did you choose that?
Well, look, the FDA, as you know, have a lot of issues, and there's a lot of politics in it. And now they fired, 20,000 employees. They don't even have committee. If I want to do something novel, to apply and say, would you revise my application? They don't have that. So I don't want to wait for the FDA, no offense. So that's why I'm trying to do it in the Bahamas. We're very behind in the United States. MRT, or mitochondrial replacement therapy, has been approved for decades in the UK and other countries.
I want to talk about that too.
And until now, they don't have any approval in the United States. It's ridiculous.
Yeah. And so is the PRP is legal in the States and FDA approved, but it's the adipose stem cells that's not?
Yeah, the PRP and the adipose, no, I could do both here in the US.
Oh, you can.
The reason why adipose PRP is okay and the FDA came and inspected and they didn't complain or anything, they were fine with it. It's not approved, but it's not disallowed because
Got it.
When you take cells, I'm not treating those cells with any chemicals. Minimal manipulation is totally fine but no enzymes, no collagenase, no culture, nothing. Those you can't do. You should do outside. But here you could do PRP and adipose PRP.
Got it.
But because the umbilical cord exosomes come from a third person, now you're crossing the line.
Yeah.
And now I can tell you one thing. Sorry, I don't mean to interrupt you, Danielle, but I have a lot of couple now. They came to me and said, I have a baby, number one, and I stored their cord blood. Can you use it for my ovaries? And we're going to do that. So I'm very excited to see what the result's going to be.
And what are the risks involved with getting PRP or stem cells the way that you're doing them?
I'm not aware of any really serious risks. Otherwise, I wouldn't have done it. I mean, those things come from your body, putting them in different parts. It's like skin transplant, right? If I put skin from one piece, put another place, it's not going to become cancer. Now, anytime you put a procedure, though, procedures have risks. This is, even when you take blood from a patient, you might faint, you might die, you might So, but a mini liposuction, it's very minimal. There's not even cutting. It's just tiny hole. There's no suture, nothing. And it takes, so it's basically the procedure risks is really more of the injection of inside the ovaries. anytime you inject through the vaginal tissue to the ovaries, you have to tell patient there's a risk of infection, there is a risk of bleeding, blah, 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 the regular. It's like the same risk as an egg retrieval, for example.
Right. But there's no risk, using third-party stem cells, do you think, if you're going that path?
I'm not aware that the umbilical cord stem cells can become cancer. Everybody's have theory. As I mentioned earlier, the embryonic stem cells and the pluripotent stem cells are well known to become cancer. I will not touch them. But the umbilical cord stem cells, even though it's from third party, it does not cause cancer.
Interesting.
Let's talk about the mitochondrial replacement therapy. What is that? And why would someone need that? Because your mitochondria come from your mom, right?
Well, the mitochondria come from your mom. Good job, Danielle. That's right. That's why you should love mommy more than that. I'm just kidding. No, so let's talk. This is a very detailed, but I'm going to summarize it in lay language. Let's talk a little bit about the egg. The egg is like the egg we eat. I love food and you guys like nutrition, so I'm going to talk about that. The egg has a white that has mitochondria, all those things. It's the engine. And the yolk is the DNA, right? Your DNA doesn't change when you're 20 or when you're 100 years old. Now, this is what happens with the egg. Because that egg, the white, imagine the white is the knife for the yolk. The white has to cut the yolk in half because I only want half of woman's egg, right? So I want half of her DNA. And the sperm has to split in half with 46 chromosomes. So I just want 23 from the mom, 23 from dad, yeah? So the egg has to cut. Now, as women get older or they eat crappy food or they have inflammation, guess what? The yolk and the DNA is fine. It doesn't change ever. But the white is what's aging and not functioning properly. So the knife is not sharp. So now it's cutting the yolk, not in half. Abnormally, one piece is bigger. So now instead of 23, it's cutting to 24, 22. Now, if you add 24 chromosome to 23 sperm, that's 47. That's an extra chromosome Down syndrome or bad egg quality. You follow me? So now, diet, PRP, vitamin D, CoQ10, healthy, everything improves the white. You're sharpening that knife to cut the egg better, to have a 23 chromosome and better quality eggs. And that's why there are ways to improve the egg quality. And that's why when some doctors tell patients, oh, there's nothing to do to improve egg quality, it's fucking driving me crazy. So there is. Now, no matter what you do in certain patient population, it's hard to improve that white. This is when MRT comes. Get a donor egg, get the white from donor egg. You don't need the yolk, you want your DNA. The yolk has the DNA that you pass with. You took your yolk, put it in the white. Now I have a reconstructed egg with a younger mitochondria. Now mature it, it's more likely to split equally. That's the whole purpose of MRT. And we did the first baby in the world when I was at New Hope with Dr. John Zhang. And we've been studying this for decades. So that's going to change the whole game. And I can tell you donor eggs will become history really soon. Yeah.
Except to donate to get the white, right?
Exactly.
Interesting. Wow. And so how do you know you're a patient for that? Is that somebody who has a past of 47 chromosomes or miscarriages or?
Great point. There is a lot of stages of MRT, right? A lot of people do MRT in Europe, but they're totally different than the ones I do. So great question. There is a lot of people who have normal chromosome, the eggs, but they're not developing embryos. So you could do the MRT after fertilization. So there is multiple stages of MRT, but you need to kind of know the history and what happens in order to determine where you want to do it. Now, the one that I'm doing that nobody does is for abnormal egg division and abnormal chromosomes. But for those, remember very well, you need very small immature eggs to do that because you want to correct the DNA or change the white before it splits the yolk. If it split the yolk, it's too late.
So I have a girlfriend, I think I sent her your way already, but she and her husband have, the genetics where she needs to do IVF to make and test the egg to make sure that it doesn't contain the genes that they're looking out for. And she's really been struggling. She's done multiple cycles, and she does the egg retrievals, and she's not getting good eggs, is what they're saying to her. So at what point is this a treatment that you would do for her, or what would you say to somebody in that?
Well, I'd like to know more, because I can tell you, and this is when I talk about low-dose egg freezing and low-dose IVF. Look, guys, whether we like it or not, whether you agree or disagree, the IVF drugs are bad for egg quality in 50% of women. Let me repeat this. And I'm happy to have anybody here join us, expert, and I will discuss with them. IVF drugs are bad for egg quality. I see 50% of my patients coming, they have good eggs, but now they do IVF. They're cooking them. They're burning them. I'm going to give you an example. Call me crazy. I see patients every day, and I talk a lot, by the way. Feel free to shut me up anytime.
You're great.
How many hours we have? Just kidding. Look, I have patients. I'm going to give you scenarios, and you tell me if I'm crazy. Okay. First of all, there's plenty of studies. So you don't want to believe the studies? Sure. I'll tell you clinical scenarios that I see every day. I have so many patients coming to my office who did 4 or 5 IVF cycles somewhere else, never make an embryo or a blastocyst, we call it. Never. All discarded, all bad. Those couple, they're doing IVF for gender selection. Let me repeat that. They get pregnant like this. They just keep making girls. Their problem is not infertility, guys. But now you're pumping them a shot. They can't even make an embryo. That's not their issue. So tell me, is that an example? If this is not going to tell you that IVF drugs are bad for equality, I'm not sure what would. Another cases, scenarios I see, and let me tell you this. A lot of women have recurrent miscarriages. When you have a miscarriage as a woman, after having sex at home, you're developing one egg, it's fertilizing, it's making a blastocyst, going to the uterus and sticking. But because it's chromosomally abnormal, most likely, I'm talking about this scenario, and now it's coming out. Fair? Now, they tell them you need IVF. They pump them with shots. They can't even make a blastocyst. That's not their issue. They were making embryos naturally. Now they're not. If this is not going to tell you that IVF drugs is bad for egg quality, I'm not going to sure what would. Third thing, egg freezing. Women who froze eggs earlier on and come to use their eggs later on, and these are 2 studies, one from Harvard, one from NYU. It's not from me. They came to use them later on. And by the way, a lot of those people had babies in between, but they're keeping the egg frozen when they were younger for backup. So they had babies up between. So they had babies even with older eggs. Fair? Now they're thawing those eggs to have babies. Only 35% will have children. Let me repeat that. Only 1/3 of women who have baby eggs frozen in the past have babies. If this doesn't tell you that the high dose is bad for egg quality, I'm not sure what. Look, guys, I don't care about the quantity. You can have 1 billion eggs. It doesn't excite me. I need a baby. And the egg quality is not the number. I've had babies. IVF started with natural cycle. Patient took nothing. But now we went too far to a bad place. And I can tell you, I've had patients who have 1 egg, 1 baby. You can see my Instagram. Baby, not embryo, baby from 1 egg. So it's the quantity, not the quantity.
Yeah, I mean, that's so much more akin to the natural reproductive state of things. You have 1 egg, you then have a baby under natural circumstances, usually, obviously.
But look, Danielle, back to the white. and the yolk. We talked about it, right? When you stimulate somebody, you're rushing the white. The follicle is growing and the eggs, you're rushing the white to split, to divide the egg. When you rush somebody when I'm rushing you, cut the apple in half now, you're more likely to do a mistake than when you take your time. And that's why there are studies showing, listen to this, the higher the dose of medication you give, you're rushing the egg to split on it, the more likely you get genetically abnormal embryos. I'm not saying this.
Can you do IVF and extract an egg or eggs without medications?
I do this every day. That's my expertise. Natural cycle IVF. I do this all the time.
And how many eggs do you extract with that? One egg or multiple eggs?
It's a spectrum. Naturally, you get one egg. I give pills, you can get up to 4 eggs. Some people, but listen, Danielle and Whitney, when I say IVF, when you say IVF to anybody right now, in their head is what? Shots, pain, money. That's not the definition of IVF. Go to Google or ChatGPT and say, what is the definition of IVF? You know what the answer would be?
In vitro
an egg and sperm, an egg and sperm meeting outside the body.
Right.
But what is the definition? The definition is not shots.
And it's not eggs.
But Exactly.
Yeah.
Exactly.
That's so interesting.
Look, it is a spectrum. The medication is food, and the eggs or follicles are people. The less people you have to feed, the less medication they need. Once you give too much and you're overfeeding those people, they're going to vomit and you're ruining it. So give people, it's not more medication, I get more eggs. It doesn't work like this. People think, oh, give me more. It does not work. Your body is giving you a certain amount of follicle per month. That's all you're getting, no matter what you do.
And it might be all you need. And so
exactly.
as you said, half of the chromosomes come from mom, half come from dad. Is there any kind of this rejuvenation stem cell work being done on sperms? Or are
you doing PRP on their balls?
Yeah, it's like spermatogenesis I know is like, it's so quick, right? It's like 24, 48 hours. So it's much different, but.
Well, look, all I can tell you is I get asked all the time, can you do PRP on my husband? The answer is I don't deal with male. I refer them to my colleagues. I like Dr. Bob Berokim and Onyx. He's a lovely, patients love him. But all I can tell you, there are a lot of studies on PRP and stem cells for azoospermic men or no sperm, and has shown to improve outcome in a lot of them. But I'm not an expert in this field, so I'm going to shut up.
I think, there are a lot of studies out there showing how, reducing environmental toxins, cutting out alcohol, marijuana, recreational drugs, improving your diet quality, reducing inflammation through anti-inflammatory diet, all of that can help sperm quality.
Absolutely. Plastics. Now there's microplastics, everything in our body, and the sperm and the ovaries and the brain. They found what? A tablespoon full of plastic in a human's brain. There is a study published. So this is all bad for egg quality. That's why we're seeing more infertility, not just that one, but there's a lot of other things. And microplastic is a big problem. And if we don't remove those, it's going to be really bad. Now, there are people, they're doing IV, cleaning up microplastic, like IV, what do you call it, through cleaning up the blood. I can tell you, I offer my patient now ozone. Every patient will have 2 ozone sessions because ozone has been shown to clean up microplastics from the body. Wow. Ozone sauna. Yeah, read it. I actually wrote a review article paper, and it will be published soon, so I'll share it online when I have it ready.
I feel like that's another great treatment for longevity as well, helping to reduce toxin burden on the body. So,
and inflammation. Stuff. Ozone is natural, and it's the most powerful inflammatory agent. It kills any bacteria you want. It kills herpes, chlamydia. It kills AIDS. It's been used since World War I. And ozone is very, very powerful. And I love it. We've studied ozone for almost 10 years now. We've published a lot on ozone. Endometriosis, it lowers body inflammation. It improves their symptoms, lower pains, and better inflammatory blood levels.
I feel like this has been such an interesting conversation, especially around fertility and some alternative therapies that a woman can do and try to help work with her body instead of against it to get the outcome she's looking for. And women who are looking potentially for alternatives to hormone replacement therapy or looking to extend the longevity of their ovaries and their hormonal health that way. It's definitely something that I think, hopefully this conversation will spark more conversations out in the world. I think it needs to be something more and more people are talking and practicing and continuing to work in this direction of regenerative health and healing. Before we go, I would love for you to offer a light work practice to our listeners.
Look, I think, again, I always tell patients, you're not an egg or a uterus. You're a whole person. Focus on your mentality first, right? That you have to have the positivity. 2, I recommend you interview as many doctors before you go to a doctor. I recommend, and this might sound inappropriate or not politically correct, I recommend you interview doctors from each generation, because every generation thinks differently than the other generation. I'm now old generation, so younger doctor might have better ideas than me. And then, you need to believe in the doctor who is going to get you pregnant or go somewhere else. And I'm talking about myself too. You need to find the right fit. Focus on the brain, focus on your whole body. You're not just an egg on everything. Focus on diet, focus on inflammation, because yes, you could do it if you want to. And don't give up, because there are a lot of ways, whether clinically proven, experimental, or in other countries, that can give you a baby and change your life. This is not a car, that's a baby. That will change your whole life. And to me, it's worth it.
Mm-hmm. Beautiful. Thank you so much for your time.
I'm having so much fun. Do we have to go?
Yeah, you've got to go help people make babies.
I know. I have actually a patient 10 minutes ago has been waiting for me on Zoom.
Oh, no. Okay, go.
I'm never on time. But I'll try my best. Thank you so much, guys. That's a lot of fun. Love you guys.
Thank you. Bye.
Bye.